Hey everybody, I'm John Barrett, Communications Director for the Stem Cell Research Center, located in Colombia, South America. In this video, I want to introduce you to our stem cell megadose total body rejuvenation treatment. This is the first proven anti-aging therapy. You're going to discover how our total body stem cell therapy can help you overcome any ailments or chronic pain you might be experiencing and help you have a more vibrant and active life well into your old age. I'd like to begin by sharing a foundational piece of information, and that's that every time you have any sort of injury or ailment and a healing occurs, that healing was a stem cell mediated event. So your ability to heal and develop new tissues is directly related to the number of stem cells that you have and the effectiveness of those stem cells. The problem is, as we get older, innately, the supply of stem cells is continually decreasing. So it's an economics problem of ending up with a high demand for stem cells and a low supply situation. You can see in this table of what happens to your bone marrow production of stem cells. When you're born, 10 out of every 10,000 cells in your bone marrow is a stem cell. And then it immediately starts to plummet as you become a teenager. And then when you get to age 30 and then age 50, look at that. It's decreased by a factor of 40. And then once you get to age 60, it's decreased by a factor of 200. So it's like a needle in a haystack, and you just don't have that supply that you need to cure an ailment or an injury. I want to set the stage by talking about an experiment that took place in 2004 at Stanford University. And this is a probiosis experiment. And if anybody ever asks you about probiosis, this is what the experiment looked at. Basically, it took two mice, an old mouse and then a young mouse, and they spliced the two mouses' circulation systems together. And they wanted to see what would happen. And so what they found was that the young mouse was able to convey a lot of rejuvenation capabilities to the old mouse. So for instance, they gave the old mouse some skeletal muscular injury, and they found that it was able to heal that injury as if it was a young mouse. Something from the young mouse was coming through the bloodstream and creating a fountain of youth situation. And today, we know that something was stem cells. To explain exactly what stem cells are and how they create their magic and healing transformations in the body, I'd like to share a TED Talk from a very famous stem cell doctor named Dr. Roberta Shapiro.
Now, what are stem cells? What do they look like? This isn't a solitary, isolated stem cell. This isn't a stem cell going through cell division or mitosis. These are stem cells attached to blood vessels. They flatten out and they encircle the blood vessels. That's where they live. Stem cells also produce over 3,000 different growth factors, or what we call trophic factors, which are proteins. And it's these little bundles or microvesicles that are really the sort of worker bees. These are the things that we're looking for. But where do we isolate stem cells and these growth factors from? In fact, we can get these stem cells from almost any tissue in the body, but some of the most plentiful and potent sources are actually from postnatally derived tissue: umbilical cord, amniotic fluid, placental tissue. One single umbilical cord can treat hundreds of patients. This is staggering to me. There are a growing number of countries around the world that allow the processing of these forms of stem cells from postnatal tissue. Some of them are listed here, include South Korea, Japan, Israel, India, Panama. The list goes on. Not yet in the United States, and I hope that's coming very soon. I can imagine, therefore, a world where we can harness the power of these structures that we have available to us. One of the challenges that we face is that there's an inverse relationship between our age and the number and potency of stem cells that we have. So when we're born, you see we have about one stem cell for every 10,000 or so bone marrow cells, but by the time we're 80, we have only one stem cell for approximately every 2 million. This is exponential attrition rate, and it really plays a big role when we're trying to decide where we're going to get the source of cells or tissue to treat different clinical conditions. Obviously, as is the case most of the time, younger is better. So we are inundated in our lives through the internet and social media with what I call information overload. How do we sift through all this? How do we know what's true? How do we know what's safe? I get articles almost every day from my patients talking about cell types, cell safety, cell harvesting, cell culture, cell application, cell delivery, cell expansion, to sell or not to sell. I don't know anymore. It's very confusing. Now, in the course of all this in my career, about 10 years ago, I got very sick. I was infected with Lyme disease, which invaded my central nervous system. I had severe cognitive changes with short-term memory loss, word-finding difficulties, which I'm experiencing right now. I had severe burning muscle pain. I had joint pain. I had balance and coordination problems. I had low-grade fevers. I had fatigue. I was really, really sick. I had developed an autoimmune form of a thyroid condition that I was told was triggered by the Lyme disease. So I underwent almost a year of very conservative management with both intravenous and oral antibiotics and a slew of other drugs to treat my symptoms, my side effects. At the end of that year, I was definitely improved, but I had residual symptoms that I knew were inflammatory in origin. I had persistent muscle pain, joint pain, the things I hear from my patients every day. I still had my thyroid condition, which was autoimmune, and I knew from all my years of research that the answer for these types of inflammatory conditions was in the world of stem cells. So I decided finally to put my body where my mouth was, and I went off and received intravenous infusions of stem cells. My recovery over the next weeks to months was nothing short of remarkable. Almost all of my symptoms had abated, and wow, look at that. I returned to a normal function of life. But my bigger challenge following this was, how do I apply this then to my patients? How could I clinically apply it? So I started researching. I knew that I wasn't going to start with the big diseases in my practice. I wasn't going to start with muscular dystrophy, multiple sclerosis, Parkinson's disease, Alzheimer's, ALS. I knew those would require large doses and infusions of stem cells that we could not yet apply in this country systemically. And so I knew I was going to start with the smaller diseases, the joint pathology, tendon and ligament types of problems. So I was researching the regenerative therapies available to us in this country, in the United States. And while I was doing this, a friend of mine happened to call me. He's 54 years old, and he said, I fell off my bike a couple weeks ago and I can't lift my arm. The MRI says I have a complete tear of one of my rotator cuff tendons, something I see every day. 2 top orthopedic surgeons in New York told him the only way to fix this was to surgically repair it. And they were right. When you have complete tear of a tendon, you have to surgically reattach it. My friend was obviously looking for a non-surgical option. So I looked at his MRI first, and I thought I saw a tiny strand of tendon still attached. This was important because it would give me the substrate to work with. So I went back to my research and I started looking at the hierarchy of regenerative treatments available to us. The first one is something called platelet-rich plasma, which very simply is drawing blood from a person, spinning it to concentrate the growth factors, and then you re-inject that into the same person. This had promise, but I didn't think it was going to be strong enough for this magnitude of injury. So the second level in the hierarchy of treatment is what we call either fat or bone marrow-derived stem cell treatments. It's a same-day treatment. We're allowed to do it in the US. You extract a small amount of fat or bone marrow from the person. You put that product through a very sophisticated centrifugation process, which concentrates the stem cells and the growth factors, and then you re-inject that into someone. And I thought, this is really getting a lot closer to what might work for him. But then I remembered what I said, that inverse relationship between age and the number and potency of the cells. And I thought, 54-year-old cells, that might not work. So I went to the next level in the hierarchy of treatment, which is very different, and it's the use of postnatally derived tissue, amniotic or placental or umbilical cord. Labs around the US are permitted to isolate the growth factors from that hours-old product, and then we can inject that into somebody. And I thought, hours-old product versus 54-year-old stem cells, it was kind of a no-brainer in my mind. And so I went back to my friend and I said, look, there is this product I'm going to use from amniotic tissue, growth factor. I'm very comfortable with the safety profile of it, but I have to tell you, it's super expensive. It will likely not be reimbursed by insurance, and it may not work. What do you think? And so my friend laughed, and he said, sure, let's try it. What do I have to lose? So I injected him with these growth factors, and within 2 weeks, he had 30 degrees of movement. Within 6 weeks, he had full range of motion. This is unheard of in the world of sports-type injuries like this, but it was only a single case, and I had to repeat this in other cases. So the next case I did was a gentleman in his 70s that I've treated for many years with polio who had end-stage bone-on-bone osteoarthritis of both of his knees, and he was facing joint replacements. We both knew that with his history of polio, he would end up in a wheelchair if he had these surgeries. So again, we looked for a non-surgical option. I did the same thing with him, and within weeks, he was walking pain-free, and he continues to walk pain-free 3 years later. I have since repeated this in dozens of cases with pretty remarkable results. So I just want to say before I conclude that first of all, every tissue and cell structure that I've been talking about today is harvested from after birth. These are products that would be thrown in the trash. They would be discarded. So there should be absolutely no ethical dilemma with the use of these tissues or cells.
In Dr. Shapiro's TED Talk, she identified 3 very specific reasons why people go south of the border to get stem cell treatment. And the first is that younger is better. The younger the cell, the better. And the ideal cell is the mesenchymal stem cell, which comes from the umbilical cord. And get this, it has no genetic imprint, meaning it hasn't even made it to the baby yet. And so it has the potential to be any kind of cell and to work anywhere in the body. The second thing she said is that it is super expensive to get mesenchymal stem cells in the US, and that's absolutely a fact. And then the third thing, which was really important, is that you can't get the large enough doses of the mesenchymal stem cells in the US to create the best results. And the reason for this is because of culturing. The United States does not allow culturing, whereas in South America, you can take 1 million mesenchymal stem cells and transform them into 200 million. They multiply, and it's a very established practice. It's been practiced all over the world for the last 10 years. Now, on this point, you notice she left the country as well to have her mesenchymal stem cell treatment on IV for the Lyme disease. And that's the same thing that Mel Gibson's father had to do. When you're having these IV treatments, you're going to want to have between 100 and 200 million mesenchymal stem cells to have the optimal results. If you're going to go outside of the country to receive stem cell treatment, to solve a chronic pain problem, to solve a health problem that you cannot get solved in the United States, or simply to prolong your life and give yourself a higher quality of life, then where do you go? Allow me to introduce you to the Stem Cell Research Center and its founders. The Stem Cell Research Center was born more than 20 years ago in the Laboratory of Medical Genetics and Teaching at the University of Pereira in Colombia, South America. There, 2 professors of medicine, Dr. Julieta Bonilla and Dr. Carlos Mejer, created South America's first laboratory dedicated to the collection, culturing, and cryopreservation of stem cells for medical treatments. This is Dr. Carlos Alberto Mejer. He is a physician and a surgeon. Since 1996, he has been a professor and researcher at the medical school in Pereira. He's an expert in pharmacology, genetics, and regenerative medicine. His partner is Dr. Julieta Bonilla, an MD, and she's also a geneticist and professor of medicine who specializes in prenatal diagnosis and in vitro fertilization. Part of Dr. Julieta's path was to find the best medicine on the planet. And when the early clinical trials on stem cell medicine created miracles for some patients, Dr. Julieta tuned in. Over the next 8 years, beginning in 2008, Dr. Julieta and Dr. Carlos treated colleagues in the medical community as well as their family and friends. The first successful patients were other medical doctors who had knee arthritis and did not want to risk surgery. Over and over again, the stem cell treatments were successful at completely eliminating chronic pain. Then the doctors began to treat people with problems in their shoulders, their lower back, and their other joints. As our confidence grew, we expanded our team of caring doctors to include a spinal expert, a neurosurgeon, and a cosmetic surgeon. We also expanded the types of treatments, adding in an IV treatment for internal organs, a spinal treatment, a brain treatment, and even cosmetic treatments. In 2014, Dr. Carlos and Dr. Julieta founded CMAB Biotechnology, Colombia's first commercial stem cell laboratory, and later they opened a second stem cell laboratory in the country of Panama. They have a pristine safety record, and their quality assurance standards are actually more stringent than those of the FDA. They are very, very particular about how they obtain their umbilical cord tissue and the steps for processing and culturing the mesenchymal stem cells. Dr. Juliana and Dr. Carlos are currently conducting stem cell megadose total body rejuvenation treatment research studies. This is an anti-aging therapy and preventative medicine at the highest level. Even if you're doing everything right in terms of your behavior, in terms of exercise and nutrition, you're going to be losing stem cells with age. And the ones that you do have become less active and they become less functional. Unfortunately, that's part of aging. So what we're trying to do here is turn back the clock to a degree and replenish most of those stem cells. With our total body rejuvenation treatment, you will receive stem cells in literally every part of your body. We take mesenchymal stem cells and we complement them with exosomes and we distribute them evenly throughout your body. We're going to treat all of the moving parts of your muscular skeletal system, the soft tissues of the spine, the ligaments, the joints. We're going to inject both shoulders, elbows, knees, wrists, hips, ankles, and even your feet. We inject all of the moving parts. With our IV treatment, we can deliver up to 200 million active young mesenchymal stem cells right to your internal organs, your heart, your lungs, your kidneys, your liver, and your spleen. And the magical thing about mesenchymal stem cells is they work like heat-seeking missiles. Whatever part of your internal organ system where there is danger or inflammation, the stem cells will immediately go to work repairing. The two biggest causes of age-related deaths are heart failure and stroke. And in both of these conditions, the deterioration of your body begins many years before the fatal event. IV treatment with stem cells can repair damaged blood vessels and pathways to prevent a heart attack or stroke. We also have a neurosurgeon on our team who does some very specialty procedures on the spine and the brain. A procedure called intrathecal enables us to deliver stem cells directly into the fluid-filled space between the thin layers of tissue that cover the brain and the spinal cord. There's also a nasal procedure that provides stem cells for overall brain health and longevity. A third doctor, our cosmetic surgeon, focuses on skin rejuvenation and sexual optimization. A lot of people call it the fountain of youth phenomenon, and we won't disagree with that. We could go into some of the studies showing the old mouse and the young mouse and the effect the young mouse's blood had on the older one, but it's the same concept that when you're providing young cells, young proteins into a person's body, the reaction that they spark helps the older cells to reprogram themselves and regenerate and help repair. And the result is that you feel better and you think more clearly. Your pain disappears, and most importantly, you're preventing potential problems in the future. Consider this testimonial from a man who recently had stem cell treatment throughout his entire body.
You want to know the key to a long-term memory? Do this. Information combined with emotion becomes a long-term memory. I just had my full body makeover about 48 hours ago, and so post that, so my face might be a little bit red. The inspiration was I have, the big one was I have a torn rotator cuff. I also did years of Aikido, which is all joints and big falls. One of the other reasons is because I had a traumatic brain injury when I was 5 years old. Led to a lot of severe learning challenges, and I think it's very important to take care of the hardware. I teach people the software on how to read faster, learn languages, remember people's names, focus and concentrate. One of the reasons why we're here, this ultimate adventure we're all on, is to be able to realize and reveal our fullest potential. I think if there's one thing to take responsibility for, if there's one thing, be responsible for how you feel. Does that make sense? Because all learning is state dependent. All learning is state dependent. And that includes biologically. And so we don't only want to live longer, we want to live better. And I want to be able to be there with my family and be vibrant. And so, a process like this that can not only add years to your life, but life to your years, that's priceless.
What to do next? The process is fairly simplistic. It starts with a free phone consultation with one of our experienced stem cell advocates who will listen to your history and take you through the different treatment options and pricing. If you qualify for a procedure, we will then send your medical records to our doctors for review. Next, you'll have a Skype interview with the doctor to discuss the exact treatment plan and the exact price. Next, we have a patient concierge representative who assists you with all of your travel logistics, including travel from the airport to our Renaissance Rejuvenation Center, where you're going to stay for 3 nights. While you're at the Rejuvenation Center, we're going to have very special nutrition, very special massages, and very special exercises to put you in the right frame of mind for healing. So if all that sounds good to you and you'd like to speak with someone from our office about participating in one of our patient-funded stem cell research studies, then here's what to do next. Click the button below, enter your information, and schedule your call. My name's John Barrett. I'm the Communications Director for the Stem Cell Research Center. Thank you for giving me this opportunity to share our offer with you.